You are now in tune with the community on 318 Latino. Meet interesting people who make our community great. Hear their stories, check out their projects.
Gracias.
Hola, 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 mi gente hermosa, preciosa, chula, bonita, cositas caídas del cielo que nos escuchan a través de 318 Latino. Nuevamente aquí su amigo, su servidor, su compadrito Brian García, acompañándolos desde el downtown de Shreveport. Hello, 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 you beautiful people. How are you doing today? My name is Brian Garcia from 318 Latino here in downtown Shreveport. And the reason I'm going from Espanol to English back and forth today is because we have a very, very special guest here with us today. We have Miss Samantha Ortiz, Sam Ortiz, caseworker, social worker, case manager with the Philadeplhia Center. You doing all right today?
Yeah. Hi. How is everybody doing? ¿Cómo estás todos? Perdona mi español, no es perfecto, pero sí puedo hablar Spanglish. Really
Eso. We'll work with that. I can do that. Yeah. Spanglish is it's second nature to me now.
Especially those of us with Mexican parents raised in this country.
Right. That one's for a lot of my second generation Hispanics. That's basically life.
Yeah, that's our life. So.
Duality. Ok, bueno, el día de hoy vamos a platicar acerca de lo que viene siendo el Philadeplhia Center. Today we're going to talk about Philadeplhia Center, what they do, who they are, how they help our community. But first, let's start with you, Sam. Tell us a little bit about you. Where are you from? What are your roots? And how is it that you got involved with the Philadeplhia Center?
So, me llamo Samantha Ortiz. Mi familia me llama Sam. Yo estoy de aquí en Shreveport, pero mi papá es de San Luis Potosí. So, cuando era niña, yo fui a San Luis para ver mi familia y todo el tiempo estoy en México y aquí. Pero yo estaba trabajando en Filadelfia por 6 años. Uh-huh. Y cuando estaba en la escuela fui ahí para mi internship. Okay. Y yo fui a Filadelfia porque yo quería trabajar con gente que era LGBTQ. Uh-huh. Yo no sé cómo decir eso en español.
I think the initials are the same. LGBTQ.
Yeah, es el mismo. So,
uh-huh.
Yeah.
Y bueno, pues vamos a platicar un poquito más acerca de qué es el Philadeplhia Center, qué hacen ahí.
So, yo voy a hacer esa pregunta en inglés.
Está bien. What is the Philadeplhia Center?
So the Philadeplhia Center, just so that I can explain it better, but
right.
The Philadeplhia Center, we are a nonprofit center that serves people in the community that are low income and that mm-hmm. are HIV positive. Mm. But we also serve people that aren't HIV positive on our prevention side. I work on the social services side. Mm-hmm. So I primarily serve people that are HIV positive, mm-hmm. but the center also serves people. We do HIV testing, we do PrEP. There's a number of things that we do surrounding STDs and reducing the spread of HIV in Northwest Louisiana.
Right. And, I see a lot of news coming out from Louisiana in general, mainly what is the the New Orleans area. And there is a high intensity rate of STDs in Louisiana compared to the rest of the nation. Do you know what the rates are versus the rest of the world or the rest of the nation? I'm sorry.
I don't know the exact rates mm-hmm. because they are changing almost daily. But I will tell you that Shreveport, Caddo itself, has some of the highest infection rates in the state. Mm. We also have some of the highest rates of people that are HIV positive and not receiving treatment. So we have a lot of people that are HIV positive in this area of the mm-hmm. state that are not taking their medicines and are not receiving treatment, which is a problem because treatment is the number one way to keep it from spreading.
Right.
And in terms of Caddo Parish itself, we're number one in the nation for several STDs, gonorrhea, chlamydia, and our rates just for HIV are especially high here. And a lot of the reason for that is because we have so many minority populations. The numbers of HIV is rising in our African American population and in our Hispanic population. And the biggest problem we see with our Hispanic population is they don't reach out for treatment. I have been seeing a little bit more of that lately, but we would love for the Hispanic community to know that we're here and to reach out and get help, because that's what we're here for.
I feel a lot of them, just in general, don't have much access to healthcare.
Yeah, and what's crazy is not having access to healthcare is something that we help with. So if you don't have access to healthcare, a lot of people know my cousin Marilu at the MLK Center. They work with people that don't have healthcare.
Right.
And then we partner with them a lot because we do a free clinic over there once a month for our clients that don't have healthcare, to get them free treatment and free medications. So not having healthcare can be a problem, but that is something that we're here to help you navigate. So we can get you set up with treatment. We can get you set up with doctor's appointments.
Right.
And as a case manager, I'm here to help if you need mental health assessments, if you need counseling, if you need help with your food, with electric bills, housing. There's a lot of things that we do for our clients just because we don't want them to have to worry about anything except for taking care of themselves and taking care of their health.
Well, that's really, really interesting and really important that people get that help, especially when it's necessary, because generally this type of viruses or diseases are progressive. They're going to get worse and worse with time, especially if you're not getting the treatment that you need. So your health is going to just deteriorate.
They're absolutely going to get worse over time. And a lot of the biggest problem is that, well, when you first become positive with HIV, you might not see symptoms for a long time. So you might think, I'm positive, but I'm fine. I don't feel anything. But just like you said, it's something that deteriorates your body over time. So you might feel fine now, but you're not understanding the changes going on inside of your body. So if you know that you're positive, I really hope that you'll come and you'll ask for me and you'll come to the center. And my Spanish is not perfect, but it is enough to help you get the services that you need and to help you. And I really hope that you'll come by. And if you're not positive, I hope that you'll utilize our services too.
That's preventative. So let us talk a little bit about HIV. What exactly is HIV? There was a lot of. It's new compared to many other diseases. When something new starts, there's a lot of fear, stigma, speculation, hatred, and just fear of the unknown that gets a lot of people towards not demonizing the disease itself, but the people with the disease.
We see that a lot.
Talk to us a little bit about that, about the disease itself. What exactly is HIV?
So HIV, a lot of people really get confused with HIV and AIDS. So when you first become diagnosed, it's not with necessarily with AIDS. So HIV is humano-immunodeficiency virus. Humano-immunovirology. And so what HIV is, it's in disease that attacks your white blood cells. And your white blood cells are basically your body's armor. So that is what keeps you immune to getting other things. So HIV itself doesn't necessarily do anything to your body, but what it does is it makes your body susceptible to everything else. So imagine you have this armor of white blood cells. HIV comes in and attacks all of those white blood cells so that you no longer have an immunity. So you're more susceptible to COVID-19, the flu, tachycardia, anything like that. You're more susceptible to it. And so HIV, once it progresses to the point to where you don't have but 200 white blood cells in your body, it then becomes AIDS, which is acquired immune deficiency syndrome. So a lot of people kind of get that confused. So you don't necessarily have AIDS. Some people get diagnosed with HIV and never have AIDS. And I know that there's a lot of stigma around HIV, kind of what you were mentioning, because when it first came out, the way that the propaganda machine around it ran was that it was only, minorities and gays getting this disease. So why do we care to take care of minorities and gays? And, now it's 2020 and we aren't as judgmental as we were before, and we see that this disease affects everybody.
So let me ask you a little bit about that, and not to get political or
Yeah,
to,
absolutely.
Try to push any type of propaganda in that way. But why do you believe it is that it is minorities that are getting it?
I think that minorities get. It boils down back to kind of what everything boils down to, and it's access. A lot of minorities don't have the same opportunities and access that, straight white people have. And that's just the truth. Regardless of what your political beliefs are or whatever, that's what we're seeing in our communities, and especially with the Hispanic community, what we see a lot of times is that they're scared to come in, or they're scared because they don't speak English, or they're scared because they're undocumented, and they don't realize that we don't report undocumented immigrants. We help them, and we get them the care they need, and they can get taken care of without ever getting reported or worry about their status. I served a couple of undocumented immigrants, and a lot of times they took so long to come in because they were afraid. And then you have, if you're undocumented, a lot of times you don't have health care. A lot of times you lack the proper education. Sexual education is almost non-existent. And so it's kind of a lot of factors like that kind of boil into it. But education is probably the biggest, especially living in Louisiana. We don't have a comprehensive sexual education in schools. So a lot of people, they don't understand HIV or how it's contracted, or why it's so important to get tested, or why it's so important to wear condoms and to practice safe sex. And we're seeing that just now with COVID.
Right.
People are told to wear masks, and they don't want to do it. And it's the same way with condoms. They know if they wear a condom, it'll make them safer. But a lot of times people don't want to wear them because they don't understand just how terrible the repercussions could be. But one thing I really want to stress with your listeners is that HIV is not the disease that it once was. I think a lot of times the stigma surrounding it is what it is because we remember, well, you and I maybe don't remember, but people remember the 80s and 90s when this disease first came out, and people were dying. I mean, every day, hundreds and thousands of people were dying, but it's not the case anymore. We've had 20 years of research happening since then, and we've had huge advancements in medication and in healthcare since then. And so now, if you get diagnosed with HIV, and if you go to the doctor and take your medicine, it shows now that you can live just as long as somebody that does not have HIV. And so that's something that is really important to stress, because I think a lot of people don't come in because they're scared that it's just a death wish.
Right.
I've been diagnosed with HIV, so that means that's it. My life is over. And it's not the case anymore.
There's another part of it. It's the guilt trip of, all right, maybe if I have it, I've been spreading it. So having come to that what do you call it? That
the guilt.
The guilt of having to tell other people, all right, you have to get checked too. I think that's part of what keeps people from doing that as well.
And I mean, you do see that. It's really not as often as you'd think, though. That's not as often the number one reason people don't come in. I would say that there are a lot of people maybe that were not faithful in their marriages or their relationships, and so they're usually the ones that are scared to tell their sexual partners. Because a lot of times if you have people with multiple sexual partners, sometimes they don't have contact information for them anymore. This is the day where people are meeting people on Tinder and Grindr and Scruff and Plenty of Fish, and you meet up and never see them again. And so you do come across stuff like that often. But I would tell you, if you're scared, please just come in anyways. We're here to support you, and we can help you tell people and help you find the right words. And because the number one thing is just getting you in and getting you taken care of so that you can live a long and healthy life.
Perfect. Well, I have a lot more questions about this, but we got to go to a quick break. When we come back, I want to talk about, where we can get tested, if there's a cost, if, what are the steps to go through once you become aware that you are positive, if you are positive, So let's talk a little bit about that when we come back from this break. For right now, damas y caballeros, vamos a un corte comercial. Regresamos en un par de minutos. We'll be right back. Don't change the style.
318 Latino por internet desde Shreveport.
There is a place where you can dare to dream, find lasting friendships, and a place to belong, where you can find your calling and change the world one step at a time, where you can find yourself, where you can find your anchor.
Desde Shreveport, 318 Latino.
Y bueno, pues damas y caballeros, estamos de regreso aquí a través de 318 Latino. We are back. Thank you so much for hanging out with us. And we are going back to this conversation. We are with Miss Samantha Ortiz with the Philadeplhia Center. She is a social worker / case manager, and she's here teaching us today about HIV, about the Philadeplhia Center, and how we can help beat this disease.
You know, my dad's going to get on you for being the only Mexican that can't say Ortiz.
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 I gotta go back to my roots and
Back
go
to your roots.
Ortiz.
Ortiz. My dad's going to be like, why did he say Ortiz?
Ortiz. it's you know, I gotta switch.
Yeah,
I gotta
code
switch
switching. Yeah.
that goes from
English
say
to-
from to from. You
Yeah.
know? Those R's, man, they're crazy.
It's tough.
Anyways, let's continue back on this. So testing is probably going to be one of the biggest tools, biggest weapons against spreading the disease, just like it is with COVID-19.
Absolutely.
The biggest tool that we have is knowing who has it. If you have it, you know you should quarantine yourself. You should take medication. You should take care of yourself when it comes to COVID. But what exactly do we have to do when it comes to HIV?
So when it comes to HIV, like you said, the most important thing is getting tested. Always know your status. If you're going to get with a new sexual partner, know your statuses before you have sex, and absolutely use a condom. We do testing every week. Right now, it's by appointment only, just because of COVID-19.
Right.
After COVID-19, if there is an after COVID-19, it'll come back to walk-ins. But right now, it's appointment. So you would just call the front desk at our office and make an appointment to get your test done. We also, if you're a gay, bisexual, transgender male or female, you can come to our wellness clinic. We have a special grant for a wellness clinic that treats LGBT individuals, and that's also completely free. We do the wellness clinic every month, and you come in, you get tested for gonorrhea, chlamydia, syphilis, and HIV. And if you come up positive for anything, we get you treatment for that, and it's all absolutely free. Oh, wow. Everything that we do at the center is 100% free to our clients and to this community. So you don't have to have any money to get anything that we offer. If you have health insurance, we use your health insurance. If you don't have health insurance, we work around it. So you can get tested for free. The GBT clinic is also free, and that's, like I said, for LGBT males and trans females. And then we also have a PrEP clinic, which is also free. But in terms of testing, you want to get tested at least every 3 months if you're sexually active. And when you change partners is what they suggest. And so let's say that you come in, you get your test, you test positive. If you test positive, you're then going to be referred to services side, which is the side that I work on. I do case management, so I operate a caseload. And then I also do individual counseling because I'm a licensed social worker, and I do group counseling. I do a women's support group every week. And it's had to be Zoom during COVID, but that usually we meet in person. And then there's also a men's support group. And so if you come up positive, you're going to get referred to us. We're going to help you get on medication. We're going to help you set up your first appointment. We're going to figure out what's going on with your insurance, or if you need to get on a non-insurance type program. Right. We're going to tell you about the services we provide, ask you about transportation, see if you need, housing help. We're basically going to encircle you with this big metaphorical hug, and help you with whatever you need help with. And then if you're negative, you just go about your day and come back and get tested again. I don't work on that side, but I do want to talk about our PrEP side, just for those of you who are not HIV positive.
Before we move on to that side, let me ask one more question
about
testing and the treatments. Well, when it comes to Latinos, many of us don't, we're not going to have health insurance, at least not by like ACA or that type of health insurance. So my question is a Social Security required?
Social Security number? Absolutely not. No. Like I said before, we serve several undocumented clients. We serve lots of clients that don't have insurance. I have several clients on my caseload that don't have Social Security numbers. We serve everybody. So if you don't have insurance, we get you set up with our free clinic, which we operate every month out of the MLK Center and in conjunction with Marilu. So then you'll have someone to speak Spanish with you there too.
Right.
So we have a pretty fine-tuned system now, and it's actually kind of cool getting to collaborate with my cousin in that way, working back and forth. But don't be afraid to come in if you don't have insurance, or if you're undocumented, or if you don't have a Social Security number, because we're there to help you. We're not there to get you in trouble or do anything like that, and nothing is reportable. So no, we have a couple of clients that I can think of that have been undocumented for years and have been our clients for years. And it's not a problem, because our number one goal is to help people.
Right.
That's what we care about. So.
Well, thank you. And all right, let's continue on. Let's talk about, you were saying PrEP.
Yeah. So for people that don't know, there's a pill to prevent HIV, and that is called PrEP. It's pre-exposure prophylaxis. And so basically what it is, it's shown to be about 99% effective of keeping someone from contracting HIV. So if you know that you're someone that, is at high risk for HIV, so if you are a minority, a gay male, someone who has unprotected sex, or even someone that doesn't have unprotected sex a lot, and you just want to protect yourself, you can come in to our PrEP clinic and get set up with PrEP for free. And so what PrEP is, it's just a pill that you take every single day, and it keeps you from contracting HIV. It doesn't protect you from other STDs, but it does protect you from HIV. So that's an option for people that come in and get tested, and if you're negative and you want to get set up on PrEP, that's something that we can do. Our prevention side is just as important, because we want to try to prevent this from spreading anymore and taking over our community any more than it has.
Right. That's interesting. I had no idea that there was that type of prevention.
Yeah, a lot of people don't know. And there's actually two types of prevention available, because there's also one called PEP, which is post-exposure prophylaxis. And that's for somebody that, say you wake up the next morning, you had a drunken night at the bar, and you're like, oh my gosh, I had sex with someone I didn't know last night, I did not use a condom, and you're scared. You can call us and you can get PEP, which will protect you if you take it within 72 hours of that sexual contact. So PrEP is something that is preventative, that you take every day. And PEP is something that is kind of like Plan B for HIV. And both of those things are services that we offer and that we can get our clients set up with. And if you don't have insurance, there are lots of programs that get you the pills for free. So we try to make sure that everybody gets everything at no cost, no matter what.
And that is amazing. That is really, really cool that you're helping the community out that way. Now, for those people that are interested, that want to either get tested or get PrEP, or just want to get more information about the Philadelphia Center, how can they contact you? Is there a website, phone number?
All of the above. Yeah. So anybody that is on social media, the Philadelphia Center itself has a Facebook. The GBT clinic, which is the free clinic I mentioned earlier for LGBT males, they also have a Facebook. You can also contact us at 318-222-6633. My particular extension is 2020, and if you listen to the prompts, they're going to tell you para español o prema 2020. So it'll take you to me, but and I can get you connected to where you need to go. If you speak English, you can just ask the front desk if you want prep or if you want to be set up for a test. Si no hablas inglés, puedes preguntar por Samantha Ortiz y yo puedo ayudarte con las appointments y con prep y todo eso.
Pero asegúrense de decir Ortiz.
Ortiz, yeah, no Ortiz. And we also have a Syringe Service exchange program, which maybe not as many people are going to need, but I will mention it just in case. Another thing that is shown to stop the spread of HIV is ensuring clean needles and education for people that use drugs. So if you are someone that uses drugs intravenously, meaning that you shoot up or use a needle to take drugs.
IV?
Yes, IV. Then you can utilize our Syringe Service program. It's completely anonymous. They give you a card that makes it legal for you to have clean needles on you, and they teach you how to properly use the needles so that you're not sharing needles and spreading things like HIV. And because a lot of people don't know is that you can get HIV from sharing dirty needles with people. You can also get hepatitis C from sharing dirty needles, and you can get syphilis from sharing dirty needles. And so while a lot of people might not agree with the program itself, it's designed to stop the spread of HIV, Hep C, and syphilis, because Hep C is becoming a big thing. So we operate the Syringe Service program every Friday. Like I said, it's completely anonymous. That we are sanctioned by the state, so you don't have to worry about the cops or being afraid of anything like that. So if you're interested in the Syringe Service program, you can also contact the Philadeplhia Center. So we have services for people who are positive with HIV. We have services for people that are not positive with HIV but want to be tested. And then we also have services for those that use drugs intravenously and want some more education or clean needles or anything like that. So hopefully, I'm sure Brant will put the phone number and stuff on there.
We'll have it on there.
But we definitely hope that some of you will contact us and use the services we have. So,
and once again, we are so thankful for you to come and talk to us about this. I'm sure that there's a lot of people that, either themselves are worried or have, maybe the idea that they have to get tested or they need to get tested. Definitely should. Maybe family members, friends, or it's just good to have the resource available in case you have friends that need it as well, or you yourself need it. So thank you so much for coming and talking to us about this. How can we as a community, not necessarily have to be LGBTQ or part of the Philadeplhia Center, but how can we in general just get more involved in taking care of our health and helping stop this disease and helping stop the spread?
The first thing that we could do is we could all educate ourselves on the realities of HIV. I think one of the biggest things that keeps people from getting care is the stigma. Just because a lot of people don't know the truth about it. People think that you can get HIV from hugging someone or sharing food or from someone who's HIV positive cooking your food, and it's just not the case. HIV is only contracted by swapping of bodily fluids. So unless you are having sex with somebody or sharing needles with someone, the likelihood of you getting HIV from them is slim to none. And these days, we have something called U equals U, which means undetectable equals untransmittable, which is huge. And basically what that means is if you take your medicine and go to the doctor and become undetectable, meaning they cannot detect the virus in your body, you cannot transmit the virus.
Wow.
Yeah. Is that not?
Wow.
Yes. So that's why it's so important for you to come in and get treatment, because if you are undetectable and you're taking your medicine, you're not going to transmit that virus to somebody else. And that is why treatment is so important and education is so important. So, I mean, if you want to help, the number one thing you can do is just help get rid of the stigma of HIV. Educate. testing. It's more important to know things than it is to not know things. And it's more important to understand how things work. Right. And HIV, it's just, we got to get rid of that stigma. We have to start loving our community and loving our family members and loving our peers and supporting them rather than being scared of them, rather than judging them, and rather than blaming them.
And loving ourselves enough to take care of ourselves as well.
Absolutely. Love yourself enough to take care of yourself. Go in and get tested. Check yourself out. You know, go to the doctor. I know going to the doctor is terrible. We all hate it. But, you know, it's maintenance. It's like maintenance on a car. Right. You know, we've got to take care of our bodies. So please just educate yourself. You equals you. Get tested. I really hope to meet a bunch of you guys very soon at the Philadelphia Center.
Well, thank you so much again, Samantha, for helping us out. Before we go, ¿algo más que le quieras decir a la gente latina?
Viva México, viva Shreveport y viva 318 Latino.
Eso, muchísimas gracias, Samantha.
De nada, gracias por tenerme aquí con todos.
Claro que sí. Y bueno, pues damas y caballeros, para 318 Latino, esta ha sido una entrevista con Samantha Ortiz, Case Manager y trabajadora social para lo que viene siendo el Philadelphia Center. Si ocupan más información, no olviden, déjenos un comentario aquí. Podemos ayudarle a conseguir toda la información que ustedes necesiten. Muchísimas gracias por estar con nosotros. We'll see you again soon on 318 Latino. Thank you.
Desde Shreveport, 318 Latino.